All right. Hi, everybody. Can you all hear me okay? I'm supposed to use this fancy microphone so we can get a good recording. I think I talk loud enough, but microphone will amplify me a little. So welcome. This is our session on 988. So this is more than a hotline, making 988 a door to innovative crisis response. So before we actually get started, I'm Jay Donahue. I'm a communications manager with the Behavioral Health Services Department in the Prevention Services Division. So the Prevention Services Division covers both suicide prevention and substance use prevention, which is a really good intersection basically for 988 because it covers both of those, and we'll see some of that here shortly. And then we also have presenting today Lan Nguyen, and Lan is the Crisis and Suicide Prevention Lifeline Manager with the county. And then we also have Sandra Hernandez. Sandra, what is your official title? She's the Division Director overseeing mobile crisis. So forgive me for forgetting these kinds of things. So we'll go ahead and just give a really quick background before we jump into 988, which you're all here for. So the County of Santa Clara Suicide Prevention Program has what we call a logic model. And so this is what you see, and we have some specific outcome objectives that basically help us support our goal of reducing and preventing suicide deaths in the county. And so working from the top down is kind of upstream all the way to downstream, meaning the ones that are a little bit of a higher level prevention as opposed to direct intervention. So we'll see, starting at the top, it's to strengthen our suicide prevention and crisis response systems, which this is going to cover a lot of today, and increasing use of mental health services, which is also going to overlap and kind of be involved in our conversation today with use of the hotline and use of the other services that Sandra's going to touch on. And then down at the bottom here, we have reducing access to lethal means, improving messaging about suicide in the media, and then creating supportive community environments. And cross-cutting all of this work, we're using data and evaluation to understand basically how our services are doing with the community and if they're properly serving them. And we're also working to advocate for policies that support suicide prevention, and then all of the work we aim to do in a cultural way. We want to be culturally infused in everything that we do because our county is so diverse. So this is basically the work streams that support those different objectives that you saw on our logic model. And today what we're going to focus on is that second part of the pyramid, that second tier, community helper and mental health trainings, public awareness campaigns, community outreach, and crisis text line are really how we're increasing the use of mental health services. And so tucked into that work is the promotion of suicide prevention lifelines and those services that they offer. And that's where 988 comes into play. So with that, I'm going to hand it over to Lan. And Lan, if you want to introduce yourself again, and then get going with the folks here.
Thank you, Jay. My name is Lan Nguyen. I run our county 988 Crisis and Suicide Prevention Lifeline. So 988, what is 988 and why, how did it happen? So just to give you a quick background, in February 2019, there was a group of suicide prevention and mental health advocate went to Washington, D.C. and advocate for a 3-digit, easy to remember for suicide prevention. Everybody knows about 911. If they have any emergency situation, they call 911. Easy to remember, just pick up the phone and dial that number. However, when they have a mental health situation or a crisis situation or suicide crisis, there was a 10-digit number that people have to know about it and remember to dial. And sometimes when people are in crisis, they can't remember the number. They don't know how to access the number. So because of that, the people in suicide prevention and mental health advocate went to DC and advocate for that number. As a result, then Congress directed the National Suicide Prevention Lifeline, the Federal Communication Commission and Department of Health and Human Services getting together to study the issue and come up with a 3-digit that works similarly to 911. So in late, I believe it was November 2019, they came back with a recommendation that to issue 98 as a 3 national digit that it can be used for mental health crisis as well as suicide prevention. As a result, Congress passed a law in October 2020 with a National Suicide Hotline Designation Act, make it effective July 2020, further direct all the telecommunication agencies in the country to make 98 become effective, that anybody in the country that if they have a mental health condition, a crisis situation, a suicide crisis, they can just dial 98 and get connected to one of the nationally certified 98 crisis centers. So even though 98 has been effective since only July of 2022, most of the crisis centers has been around for much longer. In County Santa Clara, we had a what was known as Suicide and Crisis Services Hotline, and now Crisis Hotline have been around for like 50 years, as long as old as I am, even a bit older. So before 98, we were known as Suicide and Crisis Services Hotline. When 98 became effective with the emphasis of mental health crisis first, we then changed the name to be in line with 98, and we became a Crisis and Suicide Prevention Lifeline. And CSPL, which is short for our name, because it's a mouthful when you actually have to say the whole name. CSPL is known as a name now. We are served as one of the hub for NSPL. NSPL is the National Suicide Prevention Lifeline, NSPL for short. And NSPL was the body that certified all the crisis centers that are able to answer 98 calls. So CSPL is now, before 98 happened, we mostly provide support over the phone, even if we determine that the caller might be better served with a team of clinicians or counselors on site in person rather than talking over the phone. We couldn't do that. But since 98 became effective, our county has a number of mobile crisis response services under Santa that we can connect or refer the callers to get in-person response. And in some cases, like the IHOT team, there are special circumstances that Santa will talk more about later. But it's because of 98, we're able to have additional resources that we can refer the callers to. So CSPL, these are the services, even though we are just known as a 24/7 suicide crisis hotline, they are all the services that we provide. Since July this year, we started to provide crisis text and crisis chat services. It's not 24/7, it's 8 hours a day. With the goal of by July of 2024, we will be able to expand to 24/7 for text and chat as well. So most young people nowadays, they don't want to talk on the phone. And because of text and chat, they're able to just text to 98 and they get a counselor who can text back and forth with them to provide support with them through text or even chat. In addition to crisis phone line, text and chat, we also provide support to people who attempt suicide or try to hurt themselves. And then we also have a weekly support group for individuals who lost a loved one to suicide. We also connect them to resources if determined that is what is helpful to them. So this is just to reiterate what we do as a crisis hotline. Previously, before 98, as indicated earlier, people have to remember the 10-digit number to get connect with us. Our local line was 855-278-4204, and the National Suicide Prevention Lifeline, if they call that number because of our certification, they're able to route that caller from Santa Clara County back to our local hotline. And currently, if they don't have to remember those 3 10-digit numbers, they can just dial 988 to get connect to us. However, the 988 has some challenges, and I'll mention those challenges pretty soon. So up until February this year, there were 13 California crisis centers able to handle 98 calls and text and chat. But just imagine California is a very large state, the most populated state in the country, 40 million people. And there were only 13 crisis centers that were certified to handle 90-day calls and crisis services. However, since February this year, one of the crisis centers decided to withdraw from the network because the requirement under 90 days was just too much for them to handle. They're basically saying that, and that was Yolo County Crisis Center, and Yolo indicated that they have such a small county, and the demand under 90 days is just too much. So they decided to withdraw. So now we have 12 crisis centers that are basically answering calls for the whole state of California. The challenges I mentioned earlier is that 90-day calls are routed by area codes, not where you're calling from. So if you live here in this county, but if you move here from some other place like New York, LA, and you carry that area code with you, that phone number, when you call 90-day, it doesn't get routed to us, it's routed back to New York or LA or San Diego or wherever that number was from. So that's one of the challenges. Because of that, we created a workaround, and basically we promoted not only 90-day, but also promote the 1-800 number, which if they call that Behavioral Health Services call center number at 1-800-704-0900, option number one, they get direct to us, directly, and not having to go through the whole routing by area codes. Another challenge with 90-day is that if a call came to us, all our counselors are busy. They never pick up that call. If that call is not picked up within 6 rings, the national 90-day bring that call back and route to a backup 90-day crisis centers. In California, there are 2 backup centers, D.D. Hurst in LA and WellSpace in Sacramento. So people might call, even with this area code, but they might end up speaking to someone in Los Angeles or Sacramento or one of the national backup center in Missouri or someplace else. That's another challenge for 90-day. Because of that, we encourage them to call 1-800 number. When they call that, press 1, it goes to us, it doesn't go anywhere else. And 6 ring is not a limitation there. So, as mentioned earlier, before 90-day, we had our local mobile crisis response team, MCRT. MCRT has been in place for like 5 years already. Which was a great resource that we're able to refer to MCRT even before 90-day. However, MCRT handle a higher acuity of callers, or higher crisis callers, and we now have other resources like iHeart MRSS, which handle callers who are younger, like 20 and under, and Trust, which is at a lower acuity or crisis of call, and CSU, which is a crisis stabilization unit. And since 90-day, our call volume just for 90-day alone has increased 25% when it's at the time it started in July and June of this fiscal year. This is a call volume. So this is just to provide you with information. There are 3 phone number or ways that a caller can get connected with us. Is to the most left column is 90-day. If they call that number, they can get to us. Or the local lines, 855-278-4204. We no longer promote the local line, but if they call that number, it still works. And as you can see, that such a high volume of our local line coming in, we don't want to turn it off yet until there's evidence that there's no more call coming in, then yeah. But even just a few hundred calls, we don't want to make it inactive or deactivate. But as you can see, our local line, 855-278-4204 and 1-800 number, they are almost the twice the call volume compared to 90-day. As you can see, for 90-day, When we first started in July, the call that came in was 1,800, and by June of this year, the call volume was 2,200. So it's about 25% increase. If you look at local lines, in June, there were 4,164 calls. July of last year, but June this year, the call volume hasn't decreased at all, even though 988 became effective. So as you can see, they still almost twice the call volume of 988. What I like to also point out is that the answer rate, the percentage that we're able to answer of the calls that came in, when we first started, our answer rate for 98 was at 68%, meaning of the 10 calls that came in, we missed like more than 2 of the 10 calls that came in. But then by June of this year, for 988, we answer at 95% of the answer rate. So that is a significant improvement of the staff and volunteers that work there. Not only 988 that we improved the calls being answered, but in July, as you can see, the answer rate was 68.92% of all the calls that come in, and by June of this year, we improved the answer rate to 83.26%. So it's a gradual increase. Our staff are working harder, volunteers working harder to be able to answer the calls that come in, and also to transfer them appropriately if determined that the mobile response is more helpful to the callers. And here, I'd like to introduce Sandra to talk about mobile response services.
So, good afternoon, everyone. Sandra Hernandez. I am the division director overseeing all of our mobile crisis services in Santa Clara County, and really happy to be here to share about our programs because I think they're pretty cool and they're pretty awesome. And we're probably one of the few in the state that has such a robust mobile crisis service that is 24/7. So, as Lon mentioned, 988, that's our kind of our portal to mobile crisis services. And so what happens is you can see, first of all, service is free, 24/7, available 200 plus languages. We have trained counselors who provide really compassionate, supportive services for callers that call seeking services as well. So when 988, somebody calls 988, it's really important to realize that there's two options here. One is phone response, which is to the right here, and that's for those calls that can be de-escalated by phone, or resources can be provided. And it's pretty straightforward. I need help, I need some direction, and maybe that's really all it's needed. Then we have the crisis portion, which is in person response, where I can the team that I oversee, which is the crisis piece. And that's where programs like we've heard already now mentioned we speak in a lot of acronyms, so I'll try to remember not to do too much of that. But Mobile Crisis Response Team, the XP program, our MRSS program, that stands for the Mobile Response Stabilization Services, and then our Trust program, which is our newest mobile team that started about a year in, and that's our Trust response. Oops. So here is kind of a graphic that I think helps best describe how the program, the teams are kind of situated within our clinic. Again, we're very fortunate that we have a robust mobile crisis service delivery system. And there's really 5 levels or 5 layers of services that can be utilized through the 988 system. Now, the first one I'm going to talk about is not, but I want you to know that it exists so that you're aware of it. Because that one is it's the only one of the 4 I'm going to talk about beyond it's 988, but this one is 911 dispatched. And it's called our Psychiatric Emergency Response Team. It's called CURT. And what's unique about this program, it was an innovation program that has sunsetted, but with the support of our Board of Supervisors, we've been able to sustain that program. We have 8 positions, and because we thought we were not going to be able to sustain that program, we had 5 actual independent law enforcement agencies approach us saying, we'd still like to partner with you and have a PERT team in our community. So when all is said and done, we're going to have 13 teams throughout north, south, east, west, which is really pretty awesome. But that team is unique in that it's a licensed clinician paired with a law enforcement officer. They have the officers dressed down. They're either plain clothes or more of a polo shirt and kind of they call khaki pants and BDUs. A little bit different dress. Unmarked car, and they're selected. They're not just we pick an officer. These are folks that are interviewed and selected to be dedicated officers because we want them to have that sort of sense of understanding of what it is to work with somebody who's in a mental health crisis. So we really want them highly trained. Just like the clinicians who are also selected, especially for this program, because we want them to also have that complement to be able to work well with law enforcement and also help to inform law enforcement about what it means to work with a certain population of people who are in crisis. What distinguishes this particular team is that they see the most acute, most highly sort of in-the-moment kind of situation where there's a crisis existing like right now. And generally what that has been is situations like suicide in progress. We've had a few unfortunate situations where that's happened. And those are the kinds of calls they're responding to. And they're not just responding to the individual in crisis, but the family, because the family is a huge piece of that. And with all these programs, just so you know, we are really supporters of the AB 24-4 form, which I don't know if you're familiar with, but it's a form that is you can find on the NAMI website. So thank you to NAMI, who has supported this legislation to put it out there so that people can use those forms to help provide information about their loved one. So it's an opportunity for them to put when they're thinking less much in a stress situation. What's the history of my loved one? What hospitalization, medications they may be taking? Anything that would be helpful for the person who's on scene to know. So we really strongly always advocate. But that's really what PERT is about. They are not 24/7, so just want to know that. But they vary from hours. So some start at 7, some end at 11. Some are Monday through Friday. Some Monday through Friday. Some are 4 days a week. They work 4-10 schedules. So they have differences, and they're throughout various locations in the county. Mostly right now with the Sheriff's Department with 2 teams. We have a team in Santa Clara, but like I say, we've got now approval to go forward now to start to hire. So I'm really excited about to do that for those professionals. So let me focus mostly on the remaining team, which is our NCRT team that launched. And that is our mobile crisis response team. Again, it's clinicians, licensed and unlicensed, license waiver, who are wanting to get their license and making active movement towards that. They are dispatched through 988 or the 1-800 number that Ron and they see basically a step lower than PERT. So they're going to be more to the moderate to high need. So they're going to be folks that likely will maybe need a 5150 hold because they're either danger to self, danger to others, or barely disabled, or they're there to help de-escalate a situation that's gotten out of hand. And law enforcement sometimes accompanies them, but we really want to say it's based on the criticality of the situation, not an automatic. We really want to be respectful of not every call requires a law enforcement presence because we don't think it's always about a legal aspect to the crisis, de-escalation, resources, safety planning. That's what's important to us. That is a 24/7 program. Again, we serve adults primarily, although we will see, just like PERT, we will see people who are in the younger age range if needed in the moment. If it's about, delay of care, we won't just wait for somebody to show up. We will just deal with it. So that's our MTRT team. We have a team that is situated in South County, a team in North County, and then the bulk of the calls are primarily in South. But we are staffed with about 20 staff. Right? And within there's different languages. We have Spanish, Vietnamese, Hindi, and Cantonese. We're very fortunate. Plus the availability to use our language. And then we have our mobile response stabilization services. This is our youth crisis services, as Lana mentioned. And again, age range is like 4 to 20 years old. They are also 24/7. We have teams through the north and the south and central San Jose as well. So we complement MCRT really nicely that way. And so they are activated through 988 as well. They also have their own crisis line or call center that families can reach out to if they need support as well. Again, these are teams of clinicians, sometimes family specialists, people with lived experience. So it's a variety, it's a different mix of staffing that occurs. And so what's really unique about them as well is they're probably 95% of the time no law enforcement at all, which I think is a great idea. We don't want kids having a crisis with law enforcement. Doesn't always make sense to me. And I've really been really clear that when my MCRT team is backing up in MRSS, no law enforcement. I don't think it's right to have a 10-year-old law officer standing by. We really believe in that and support that same sort of method of how we would approach things. Then we have our newest program, which is really exciting. It's after our trust and response support team of trust. I say it's about a year new. They, again, will see adults 18 and over. They are 24/7 as well. Again, 988. You're going to hear me say 988 a lot because we're trying to really push 988 because we really want that to be the message, not 911. 988. They, too, situated north-south, central, San Jose. So, again, we're complementing each other in terms of the places we want to be. Activated 988 or the 1-800 number. What's really nice about this program is this is a community-based approach, non-law enforcement approach. They will rarely have contact with a law enforcement officer. This one is also staffed by Pacific Momentum, their contract agencies that we're contracted with, as well as the MRSS program. But the Trusted Response Program is got bands, and we don't have them yet. They're not quite wrapped and ready to be out in the street. They're not street legal, as they say. Not yet, but they will be soon, because we still have, there's all these buying vehicles as we're learning through the counties. It's pretty chore, but they're coming. They've been wrapped, and there's a few other things that still need to occur. But hopefully you'll be seeing driving throughout the community. That's the plan. We want them to be visible. They will also have the ability to transport individuals to like our mental health urgent care program, maybe to the sobering center, to our CSU, a shelter. We're working on trying to get some potential ability to have some shelter options for folks who they might encounter who are on that lower spectrum of crisis, but still maybe need support. So basically what you're hearing is there's a level for everybody. You don't have to be way up there cute, but if you are, we have somebody for you. If you're here at the area, I need some support, I lost my home, my wife has moved out with the kids, I have nothing. Whatever the situation is, we have a response team that can help to support somebody through those places. And we'll do what we can. The nice thing is, with these mobile teams in particular, we all work together. We really make that effort to get to know each other. So we've had a number of quarterly meetings to just meet and greet, but also get to know one another so that we can work together, because clearly, as you can see, and you'll see in the next slide, it's imperative that we work closely together when we are out there in the community representing the various programs that we do. Then our last program, in-home outreach team, IHOT, is a stabilization type service. So we say it's kind of like a post-crisis service. It's really designed for high utilizers of our kind of high-end services. So people who would maybe frequent or tend to frequent emergency room, the ED, maybe they are having too many jail contacts. They might be, police, they come to the attention of police, and they're frequent 911 callers, and they're maybe using the 911 system. So we get referrals from various sources, various places. And so this is a Monday through Friday program. And again, we have a county team. We also have two contract providers that we work closely with Starlight and Bill Wilson, the Office of Civil Service as well. So their county, they serve the entire county as well. They will go out into encampments. They'll go out to where people are. If it's a home, it's out in the community, anywhere, everywhere. That's where they go. And so all these teams work really, really closely together to really help keep people safe and supported and through the services that they need. The PERT team, the Mobile Response Team, MPT, MRSS, and Trust all have the ability to write a 5150 whole. The Trust team probably, I think they've written two. I think that's not their real pitch, which is good. It's not what we want them to do. So that's not an issue. MRSS, they write what they need to write, just like the NCOT team would, as well as the need is there. We also really want to divert people away from Highland services. So the goal for us is never, let's get them to the hospital or get them to jail. We want to always look for other alternatives so that we're not sending them into that system. We want them to be able to get connected to services. Whatever it needs, or whatever it takes kind of model is what we want to come in. So this is really the same slide. It's just presented a little bit differently. But the biggest takeaway on this slide is the arrows at the top, or the arrow going left and right. It's bidirectional. What we say is it could start with a call to trust that ends up maybe with 911 and quick response. It could also be that it's PERT getting a call that really belongs to MRSS. We want to get people right place, right time, right service. That's really our goal. So this is just another graphic to help you understand a little bit about how it works. The activation still the same. That everybody's 988 except for PERT. But it's really pretty much the same information you saw on the previous slide. It's presented a little bit differently. For some people, it's nice to see it differently and helps maybe kind of get clarity on that. So I offered it 2 ways. And here's basically some data that I think is important to take a peek at as well, because it's looking at our MRSS, MTRT, BIPOC, text calls and such. And what we're seeing is, in terms of referrals for the year, there's quite a few that go to, like I said, calls that would come in, and if those calls, 443 were field visits, but actually with only really 26% going out, it wasn't a lot. And if you put that in with all the numbers of calls that have come through, it's a very small portion. It's really not big. It looks like it could be, but it's really not. Really a smaller portion, because not all calls that come to even our teams result in a field visit. They may start out that way, and then it's like, maybe you could just take advantage of the resources that we could offer, and they're happy with that. So it varies. Same thing with MRSS. Now they do see, they had 243 total calls here, and that 95 of them resulted in a field visit. They had 52% of those 3 field visits. Again, kids are different. Young adults and youth, they're different. Different things going on with them. School starting, got a lot of calls. Especially last year, at the end of, COVID ended in terms of the lockdowns and all that. Kids were going back to school. It was a real challenge for many adults. A lot of us were having troubles, adapting, getting back to that school structure. It was really a challenge for a lot of people. So our teams also experienced that kind of experience as well. So some of those are numbers that I'm The other is our trust team. Again, they're a new team, but look, already 1,500 plus calls already that have referrals. Field visits, 526. What does that say? That's a lot. And 37% of those resulted. So they're out there. They're 1 year old, and they're making a, they're being noticed. And we're really glad. That's what we want. And then we have our IHOT team again. It's because it's operated and the referrals are a bit different. There was only 81 resulting in field. And then of the total calls, we have 32 1. But remember 911 operators are dispatching to PERT, so it's going to be a little bit different. So that's not really a total reflection of all of the PERT calls. Plus, there's a lot of internal referrals that get made amongst the different law enforcement agencies. So it's not reflective here because they won't be calling necessarily. So anyway, these are some numbers, but I do think what's really important is, again, that trust is made tomorrow. That's great, because that's what we wanted to do. But everybody's busy. I think originally people said, oh, they're going to take work from us. There's plenty of work for everybody. There's a lot we could be doing out with the community. We are doing it. I'm really happy to share that. Jim, give that to you.
Thank you. Thanks, Sandra. And yeah, please. They both have covered so much information. I'll try to be quick. That way we can preserve some time for questions at the end, because I would expect that there probably are some. So one of the big things with these services that are just so unique, this is not available in a lot of other places in the country. Like the 988 we have basically access to phone de-escalation and then also the in-person responses. We really want to get the word out about that as much as we can, because it is so unique, and that we are offering something that can basically save lives. That's just the truth of the matter. And so Lon and Sandra were part of a behavioral health services department leadership team that basically helped craft a campaign to promote 988, to get it out there in the public so they're just aware of this. And so in September of 2022, mind you that 988 launched in July of 2022, the BHSD's Behavioral Health Services Department launched a public awareness campaign just promoting it among the residents. So the campaign actually was made up of 3 different phases, and each one of them targeted. I actually don't like that term, but it's the target audience. So I guess that's sort of media speak for the groups we're trying to reach. And so we have such a diverse county, we wanted to touch all of the different cultural groups and languages we have. So the different phases covered all of our threshold languages, which are English, Spanish, Vietnamese, Chinese, Tagalog, and Farsi. And we started collaborating with VTA and continue collaborating with VTA to bring additional awareness. So we're actually providing them with some of our materials that they've adapted, and they're putting at different transit stops and wrapping buses, and I'll show some images of that as we proceed. So some of the campaign materials that we have put out, you can see here. And so we have all of the different languages that we covered represented, and we took our cue from SAMHSA for this with their national materials, and we just adapted them a little bit for our own purposes, because we were trying to make this more comfortable for our residents and make them feel some of that local touch, and also because 988 is just different here. So these are just some of the items that you may have seen. There's a logo in the middle. These are different ads, and so our ads were comprehensive in basically the platforms that they were on. So they could be on the side of your phone or your laptop when you're just kind of scrolling on any type of like shopping site or news site. It was also on like Hulu streaming and Netflix streaming. Depending on the language, it was in local radio and local television ads. And we also had, as mentioned, we had some bus ads and wrapped buses for 988. So we just tried to get it out in all of the outlets as much as we could, that the different demographics and those different language and communities, cultural communities, what did they tell us are the best ways to reach them? So we just try to do all of those in those different phases. And so here are some examples of some of those VTA collaboration bus wraps. If you saw it, that bus was moving throughout the county for a while. And then we also had some wallet cards and flyers and things like that, just for folks who are tabling like right outside, just to keep it top of folks' mind. So just to give some, I sort of went a little ahead of myself here. We were online, on radio, on TV, on transit with the VTA buses, and then we had those flyers, posters, and wallet cards. And the 3 phases took place from September of 2022 all the way up until this past June. And so what our next step was as a county is we just want to be informed. We want to make sure that what we're doing is responsive to the community and what they need. So we actually just finished up a campaign evaluation survey, and it's actually not a campaign evaluation survey as much as it is a survey of 988 and experiences with 988. So the survey was going to help us achieve these, basically answer these primary learning questions. So yes, what was the reach and reaction? What are the knowledge and attitudes about 988 itself? Are people willing to call it? Are they comfortable to call it? Have they called it before? And what was your experience? So we just wanted to learn that and see if we're doing our job, if we're getting this out there and that folks are getting the services they need. So the survey itself, I'm not going to get too bogged down in, but we tried to keep it as small as we could, as short as we could. It took around 10 minutes to take. And the respondents were not told that it was about 988 to make sure that this was going to be giving us actual feedback and the folks weren't basically recalling something that we're prompting them for. So this is just a really quick example, and these slides are going to be made available to you. Understand there's a lot of content between all of these and data included. So you will have access to those, but this is just an example. Basically, the front cover sheet just asked 2 simple questions, and depending, this was online or in person, depending on your answer, you would get directed to a follow-up page if you did recall 988. So the aims of this survey, again, were just to hear the community's feedback, understand their experiences, and particularly address the shortcomings. So Lon and Sandra both talked about a lot of the challenges that we're facing with this, and so we want to work through them with the community. So we wanted to adjust our services and then adjust any kind of public awareness strategies that we're working on with their feedback. Because if we're hearing from this evaluation survey 2 things, either, I didn't even see the campaign, we clearly didn't reach them in the channels that they actually use. And if they're also saying, I had an awful experience with 988, that's something that we can work on as a department. So that's basically where we are right now. The survey just wrapped up in just a couple weeks ago, and it's being compiled, and we're going to have that community data that we're going to look to help us inform what we're going to do with both our actual services and our outreach. So I think we have, like 15 minutes or so for questions. So if you have a question, feel free to raise your hand and yes.
IHOT is 18 over. Youth, yeah, correct. Yes, everybody, we go wherever the need is, whether that's a home, a park, homeless encampment, anywhere we would go. Well, the MRSS program, I don't believe uses. Oh, I see. So the county uses, we have a contract with a ambulance company called WestMed, and that is our preferred method. We prefer not to have youth ever transported by law enforcement. So if there's a need for a transporting youth, we never have law enforcement do it. We would have to do it because the contract belongs to us, and so we would be able to assist with that. If we're out there helping and to assist at a school, absolutely, we would do that. Yeah, we would not have law enforcement do that. I'm opposed to it personally. So I don't see the value in having somebody get into a car, a youth particularly, and their family there and witnessing all of this. Now, that's not to say if somebody was threatening somebody with a knife or something, we have to then sort of take, it's nuanced, as they say. And I'm not saying that's still going to require that, because maybe we could de-escalate the situation and say, listen, could we do this in a different way? And, this is where the skills in talking and de-escalation are important so that we're not traumatizing or re-traumatizing the situation for everybody, not just the youth, but those that are involved, particularly the parents. We want to be sensitive to their needs. We do. Well, on my radar. Milpitas is on my radar. That's all I'm going to say. Milpitas is on my radar. Sure. Do you have a question for me? Sure. Absolutely. Same thing. And again, they're on my radar. Just hold tight. Maybe a few more weeks, you'll hear something come up. Yes, things are on my radar. Sorry to hear that. No, thank you, please. And this is a youth you're talking about? I don't know if you want to talk a little bit about what happens on that end.
I mean, if that happens, I mean, so there are a few challenges I mentioned earlier, and I don't know. So when there is such a situation that happen, I would hope that somebody called and hopefully they're able to get connected with me, or I know about it so I can look into it. Usually when there were complaints about an NADA that occurred earlier, I usually would, but because of the challenges I mentioned, I would go into our phone system to see if that phone number ever came to us, because sometimes unfortunately they might call us, but then they get routed to a different center because of the area routing issue, and also because of the 6-ring issue. Because if they call in and doesn't get picked up within 6 ring, it get routed to a backup center. So my way of trying to investigate to see if it came to us and what go wrong or what didn't go right, so that we can improve our services, is first just look at the phone number that call, and if it came to us, we're able to see what time the call came in, and I'm able to see during that time that the call came in, which staff work on that shift, and I can look into the issue and really address with the staff about, find out what happened at that call. And yeah. Yeah. Yeah, and I'm sorry just to hear that our protocol, our 98 counselors they don't ask for insurance or medical information, nothing like that. They just provide support over the phone, and that's what they do. They should be asking that medical or insurance information. Yeah, that doesn't sound right.
That shouldn't be asked, and I apologize that you had such a poor experience. Oh, no doubt, no doubt. I'm not doubting you. What I would say is, and it's too bad we didn't pull up to our website, but I wanted you to be aware that on our website we do have there is a grievance protocol, and please, we want to be seen as a department. So it's really important that if we don't hear feedback such as this, we can't improve. So please, if you have experienced anybody here, please let us know about it. So we can look into it and find out what was the breakdown, what was the gap in services that should have never occurred, because we don't want to frustrate you further. That is not our role. It's not our job to frustrate you and your family member. Throw your hands up and say, I don't care anymore. I don't want to do that. We don't want it to be the case. But please know that our ways to file grievances, we will respond to every single one. I would want you to know that. Even now, if you have that information, we could look into it. We'd have to. That's all right. If you want to. I mean, it's up to you. But that is some, and you can do it by phone. You can do it over the phone. Oh, perfect. If you're able to take a picture of that, yeah. Thank you for pointing that out. Yeah, absolutely. We do. Well, I'm happy you did it. And if you got this one little nugget of something to take back with you, because we do want to hear about this, because you may not be alone. Sadly. And we don't want that to be the case. We don't want to have, feeling like people don't bother with them. We want to help. I want to be able to say, we helped, somebody, with the situation. So please do feel free to tell us that. Yeah. Well, I apologize that really first. That we want to. You had a question? Strings are 30 seconds, I believe.
Yeah. Yeah. Right. Yeah. That is true, and unfortunately, that's a challenge that nationally they all experience that, and SAMHSA and local crisis centers are trying to push and advocate to FCC to have calls routed by geolocation the way 911 does, and FCC has not issued that order yet. But because it has to be issued by FCC for all the telephone carrier to route numbers based on geolocation the way 911 does. Otherwise, it just continues to route the way it does. It's a challenge. But locally, we can't do anything about it. Only FCC has the authority to issue an order to all the telephone companies to start routing by geolocation. Otherwise, this problem is continued. Yeah. So yeah, we actually doing both. We also promote 1-800-704-0900 as the option for people who doesn't have local area code. It's, it does go to our local 98 if called from 650-669 and 408. That's when it happens right away because 98, that's what they do. That's what we do. We de-escalate crisis. We provide phone support, emotional support over the phone. That's what we do. I mean, yeah, when they call that number, that's what they do. The counselor will ask, how can they help? That's the first question. My name is Lan. I mean, some of our crisis counselor might answer the phone differently. They might say, 988, this is Lan, how can I help you? Or they can say, Suicide and Crisis Services, this is Tom, how can I help you? And that's the first question that they ask. And then as the callers share more information, then it begins the conversation about how they assess the level of crisis, how they provide support. Is this whether is it more beneficial to connect to a mobile crisis team, or they can just provide de-escalation and phone support over the phone. So that's, yeah, there are certain words or questions as they go through a developed script based on the level of crisis that the caller is sharing with them. But the escalation happens as soon as the counselor starts speaking with them. So, yeah, I mean, unfortunately, not all 98 crisis centers operate the same way. Yeah, so, yeah.